my name is Paola. I'm a clinician at South Florida Center for Couples and Families, and I'm here to tell you a little bit of the type of treatments that I like to use. So I'm a behavior therapist. What that means is that I really like to use cognitive behavioral therapy and rational emotive behavioral therapy. These two are like cousins, and what they do is that they really connect thoughts to feelings. So we're going to take a simple example. We're going to break down a situation into 3 different parts, which is usually what we teach when it comes to cognitive behavioral therapy. A is the activating event, B is the belief system, and C is the consequence. A is the situation that you usually bring into treatment. B is our belief system. What are we telling ourselves about the situation? And C is the consequence, the way we feel. So we're going to take a simple example. Let's think about traffic. We all live in South Florida, and we know that we've all been on 95. We know what that feels like when you're driving and all of a sudden you come to a full stop. We're gonna look at 3 different people and the way that they choose to perceive the situation. We're gonna look at person number 1. Person number 1 is driving down, comes to a full stop, and they say, "Oh no, this sucks. Silly me. Why didn't I take another road?" This is what we call self-talk. However, they start to feel annoyed, but they can manage their annoyance. They understand that there's nothing that they can really do. And so maybe they put that book on tape and they call their boss and tell them that he's gonna be late. And still, even though they're not completely relaxed, they can stay at annoyance and they can even find a solution. However, person number 2 come to a full stop and they start saying, "Why me? I can't stand it. This is awful. I'm gonna be late. My boss is gonna fire me. Everybody's gonna think I'm an idiot." And they start screaming and yelling. We've probably seen this type of people on the road. How do you think this person is going to feel? They're probably gonna feel pretty frustrated and angry. And imagine in the beginning of the day, bringing all that into your workday, or even worse, when you're coming home, bringing that to your family, to your significant other, to your partner, or to yourself. If anger worked and all of a sudden the roads open up and you can get from point A to point B a lot quicker, then go right ahead. But it doesn't. It's not productive and it doesn't feel well. And so that's a little of how cognitive behavioral therapy works. Rational emotive behavioral therapy, what it does, it goes a step further. It says, if the worst possible outcome actually happened, would you be able to tolerate it? And so it helps you build tolerance skills. The other type of treatment that I really like to use is ACT, acceptance commitment therapy. The main message is accept the things that you cannot change and commit to change the things that you can. It really talks about living your life in accordance to your values. A lot of people come into therapy and they tell me, "Paola, I want to stop feeling anxious. I don't want to feel anxiety." And we live in a society where everything is really fast-paced. Fast fix, fast food, everybody's going to the next thing. And so people have this belief that I have to have no anxiety in order to be able to start my master's program. But really what I teach is that we have to be able to carry this anxiety, because usually anxiety shows up when we actually want to do well. And so making those connections and understanding that these are not negative emotions, but they're natural emotions. We can't control the way we think because thoughts are automatic. They come in and out. The regular person has 50,000 to 70,000 thoughts a day, so they can be a little overwhelming. But what we can choose is how we respond to them. Hopefully you got some good information about the types of treatments that I like to use. I think they're extremely helpful, and even though I make it sound easy, that person that's relaxed and can perceive the situation a little bit different, I think it's really important to understand what we can and can't not control. And I promise you, with enough practice, you will get there, where you're not going to be angry and frustrated, but you're actually going to be able to bring yourself to a state of relaxation by telling yourself and perceiving the situation a little bit different. Thank you for listening, and see you next time.